Hello, everyone. I'm Stephanie Maselli, Media Officer with the National Academies of Sciences, Engineering, and Medicine. And thank you for joining us today for a webinar on our recently released report, Ensuring an Effective Public Health Emergency Medical Countermeasures Enterprise. And to read the full report, you can visit nationalacademies.org/re-envision-PHEMCE, and the slides and recording of this webinar will be available on that page as well. And for those of you who are not familiar with the U.S. National Academies of Sciences, Engineering, and Medicine, we are private nonprofit institutions that provide independent objective analysis and advice to the U.S. to solve complex problems and inform public policy decisions related to science, technology, and medicine. For each requested study, panel members are chosen for their expertise and experience, and they serve pro bono to carry out the study statement of task. The reports that result from the study represent the consensus view of the entire committee, and they must undergo external peer review before they are released, as did this report. We have with us here several members of the committee to discuss the report. We'll start off with an overview of the findings and recommendations, and then we'll open it up for Q&A. And before we delve into the presentation, just a few reminders. This webinar is scheduled to last an hour. We'll start with that presentation summarizing the report by the committee, and then we'll open it up to audience Q&A. If you'd like to submit a question, you can simply click that Q&A button on the bottom of your screen. And if you have any technical issues during this webinar, you can contact Zoom technical support at 1-888-799-9666 and select option 2. Now I'd like to introduce the members of the committee that wrote the report who are here with us today. We have Gigi Gronval, who is one of our co-chairs, and she's senior scholar at the Johns Hopkins Center for Health Security and associate professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. We have our other co-chair, Alan Leshner, who is Chief Executive Officer Emeritus of the American Association for the Advancement of Science. We have Tia Powell, who is Dr. Shoshana Trachtenberg-Frackman Chair in Biomedical Ethics at Albert Einstein College of Medicine at Montefiore Health System. And we have Craig Vanderwagen, who's a partner at East West Protection, LLC. And with that, I'd like to turn it over to our committee.
Great. Well, I'll start. Thank you. I'll start, and then I'll pass it off to Dr. Gronval and then to our other panelists. So we're here today on behalf of the committee. Matt, do you want to share the slides and go to the, great. Can you go to the next slide? These are the names of the members of our committee. It was a wonderful and extremely diverse group. We also benefited tremendously from an absolutely spectacular set of staff members from the academies, led by Lisa Brown. The committee was very diverse in expertise. There were people who came from the public health preparedness and response business, from an array of chemical, biological, radiological, and nuclear threat studies, biosecurity, biodefense, legal and regulatory issues, and things like decision science and organizational management. We were sponsored. Next slide, please. The study was requested by the Office of the Assistant Secretary for Preparedness and Response in the Department of Health and Human Services, and we had the privilege of briefing her earlier in this week. Next slide, please. A couple of background comments about the PHEMCE. I'm going to use that acronym because I don't think I can remember how to say all of the words in the proper order. The Public Health Emergency Medical Countermeasures Enterprise. Anyway, the PHEMCE is the sole federal coordinating body responsible for ensuring end-to-end medical countermeasures, preparedness, and response. It's an extremely complicated entity. It works with and includes public and private entities that develop and manufacture countermeasures, you can read as well as I, ensures procurement, et cetera, and administers, et cetera. And candidly, it is an organization that's had a troubled history and a mixed track record. There have been an array of reviews in the past. Some of their recommendations have been taken, some have not. And I believe we were asked, the academies were asked to put this review together in order to make sure that there's a vision of how it shall be working in the future. So our review was very much future oriented as opposed to looking at, what worked and didn't work in the past alone. We of course looked at that as well. Okay, next slide, please. So the PHEMCE is a multi-agency. It's made up of federal government representatives. It's a multi-agency coordinating body, functions within the federal government, and its mission, as it says there, is to advance national preparedness by coordinating. That is not implementing. It's not the implementing body, but it's a coordinating body that coordinates medical countermeasure related efforts within HHS and in cooperation with the interagency partners. Its purpose is to ensure that the nation has the tools it needs to save lives. Therefore, it covers a very wide array of products of countermeasures, including antibiotics, antivirals, PPE, and things like that. It has a variety of responsibilities as well to report to the Congress. Next, please. So our job was to provide recommendations in light of the experiences that were had during COVID to help reinvent the PHEMCE so it's better positioned than it was in the past to deliver medical countermeasures, right time, right place, and to the right people. And that's our task and what the report is about, how to make it a more effective and efficient coordinating mechanism that not only deals with ongoing emergencies, but helps the country anticipate health security threats and, to the extent possible, be prepared to limit their impact through the use of medical countermeasures. Next, please. This was an unusual kind of a study for the National Academies in that it was called a fast-track study, which means that it happened very quickly. It happened overall, I believe, in a total of a 4-month framework, but we had 5 committee meetings, they were all virtual, held between August and September. We had 3 public meetings, one of which was a more formal workshop. But the purpose of those meetings, of course, was to get input from people who have experience both with the PHEMCE itself and with other aspects of dealing with medical emergencies like we had. Next, please. So now I'm going to turn to a bit of the meat of the report. The first category of things is delivering on the PHEMCE mission. And if you'll turn to the next page, just like any organization, in order to be both credible and effective, it's got to operate under a set of sort of operating guiding principles. And I won't go through these in any detail. Dr. Powell may make some comments about that as we get to the end. But the point is that there are best practices of how particularly entities like this ought to be functioning. And they fit in these categories that we describe in the report: ethics, operations, strategy, and of course, budget. Okay, next slide, please. So in light of the past history, particularly the recent past history, perhaps our most important recommendation is to reaffirm the PHEMCE mandate. That is, the Secretary of HHS and the Assistant Secretary for Preparedness and Response, to whom the PHEMCE reports, should reaffirm the mandate as the nation's major coordinating body for all aspects of U.S. medical countermeasures, preparedness, and response programs. In order for that to happen, and in order for that to be effective, a sub-recommendation is that the people who represent the various partners need to be of sufficient standing in their respective agencies that they are able to move nimbly and relatively rapidly, so that in fact, as recommendations need to be formulated to go to their bosses, they don't have to go through 5 or 6 layers in order to have something happen. It can only work effectively if people ascribe sufficient importance to it. The second recommendation is to adopt the systems approach. That has to do with management principles, but also with ethical, strategic, and budget goals. And again, Dr. Powell covered some of that. The third recommendation is that the PHEMCE needs to reflect the perspectives of and provide actionable guidance to its partners and stakeholders. One of the issues that we heard repeatedly was that historically, this organization had a tendency to operate not in a full vacuum, but at least in a partial vacuum. That is to say, it didn't have a lot of input. It had a bit of output, but it did not receive enough or take seriously enough. And we recommend some mechanisms, in fact, to ensure that the partners are in fact partners. That is, that they provide advice, that the advice is taken seriously and factored into what's happening. And again, shortly you'll hear about some of those mechanisms. So I'm actually going to stop at this point and move to my co-chair, Dr. Gronval, who will take you through the rest.
Thank you. Thank you very much. You can go on to the next slide. So the title, Ensuring Defensible PHEMCE Recommendations, is reflected in the charge to the committee. And the PHEMCE indeed has a very complex mission. It has to do all these things, a lot of, coordinate the work of multiple agencies and organizations. It has to deal with different health security threats, require different expertise. And so it has to have that kind of expertise on tap. There has to deal with shifting priorities depending upon emerging threats and balance a lot of competing interests. However, we did hear in the course of our work numerous comments about problems in fulfilling these conditions, that there was shifting with political priorities, and that decisions were made not in the most transparent or scientific manner, according to the people who commented about it. So in our report, we describe a way that can be, how this can be achieved for PHEMCE going into the future. Quality management systems are a recognized way to create and sustain organizations that do complex operations along about this type of work, that can provide records as appropriate and maintain records and provide reports, for example, to Congress, and can avoid conflicts of interest. We describe in the report some specific suggestions for PHEMCE and how they can adjust and deal with conflicts of interest. For example, by putting in a firewall between PHEMCE, which is developing medical countermeasures, and BARDA, which is executing on that. We also suggest that they could adopt some of the more robust conflict of interest policies that some of its member agencies have, like the FDA or DARPA. Next slide. And following along with this, we describe how they have to adopt, be metrics driven and have a process for evaluation of what they're doing at all stages. that there needs to be an objective third party to examine what they're doing and to evaluate how progress is being made. And we suggest that third party could be an advisory board, which is a following recommendation, or an organization like the GAO, Government Accountability Organization, to fulfill that purpose. We also recommend that they establish an integrated and accessible medical countermeasure data system. There's a lot to keep track of with the PHEMCE remit, and to be able to have all of this so that gaps can be identified and vulnerabilities can be addressed. That would be a great step forward. Next slide, please. So the mission for PHEMCE is, or the organizations that are a part of PHEMCE are all federal agencies, and so, but it's the mission itself is not just federal. To be able to fulfill the PHEMCE mission, it needs to go out into external partners. It needs to have private sector involvement. And so, you know, it needs to be able to coordinate beyond the federal government. Next slide. So yes, that's what I just said. Next slide. So one of the ways that we suggest doing this is to establish an advisory committee that includes this expertise from the non-federal and private sector partners on it. This advisory committee should be a strong advisory committee with that is listened to and is consulted in major decisions. It would provide an opportunity for communication between the non-federal partners and the federal partners, and that has been described as a problem in the past. That there is, and Dr. Lasseter mentioned this, that there's a way out, that there's communication from the PHEMCE, but not as much communication in, and this would provide that conduit. It would also provide more visibility for the PHEMCE, which is an important consideration because the work of the PHEMCE is so important. That mission deserves to have greater visibility throughout the government and also the whole health security community. There are a lot of other roles that it could play to help in evaluation of the PHEMCE and PHEMCE activities, evaluating what is the activities and priority setting. Now, the PHEMCE mission space is huge, and we cannot focus on all health security threats at the same time. So the advisory board, the advisory committee rather, can help to narrow the scope so that that the PHEMCE concentrates on the highest priority threats that can be acted upon. There is, next slide, please. So as far as implementing transparent communication strategies, there have been some challenges in dealing with security issues, and that's something that's always a tension between openness and security and holding of important information. But the bottom line is you cannot prepare and respond to health security threats by operating in an entirely classified environment. You need to know what is available and what you can do and what plans and what plans can be put into place with what equipment and what medical countermeasures. So things need to be as open as possible, and the advisory board can help with that. Advisory committee can help with that. And finally, we need to establish clear authorities. People need to know what they're supposed to be doing, what their roles are and responsibilities are. And this is for the federal partners as well as external partners as in this process. Next slide. So we all know that during COVID-19, the Strategic National Stockpile did not have what we wanted it to have, and the committee heard about that as well as prior problems with the SNS. We believe that it's important to not just have an evaluation of what happened during the COVID experience, but also to go a little bit beyond that and to make sure that the evaluations of the SNS that the PHEMCE conducts yearly or should conduct yearly is that they are producing a good result and that they are leading to a more prepared or better stocked stockpile. Next slide. There are other organizations besides the PHEMCE that also have this mission, this very complex mission that require developing medical countermeasures for the purpose of addressing emergency health security threats. So we would like the PHEMCE to work with these other organizations to share experience and to coordinate where possible. Next slide. So legal and policy considerations, the legal and regulatory framework has changed considerably over recent years. Next slide. And these things, we describe in the report a number of tools and laws that have been used, for example, during COVID, like the Defense Production Act, that can be used in the future. But just like technology changes over time, the legal and regulatory framework also changes over time. And so it's important to have a continuous look at what is going on with the legal and regulatory framework to make sure that the PHEMCE mission and getting medical countermeasures to people who need them at the right time, that there are no barriers to that process, and also no perceived barriers to that process, which could amount to the same thing in reality. So we recommend that there be this look to see what the legal and policy framework is for PHEMCE, that affects PHEMCE, and to make sure that that is well known and well addressed. Next slide. So the bottom line is that the countermeasure, the PHEMCE enterprise, plays a critical role in the whole of government medical countermeasure preparedness and response. We have, it's a big role that it's not just the federal government, it's external partners, it's the private sector, it's public health agencies. And given the variety of public health threats that face the nation, and then could face the nation in the future, we believe that even though there's a lot of work that's going on to address specific threats beyond COVID, other threats like nuclear threats or radiological threats, a coordinating body is always going to be needed to be able to get the American people the medical countermeasures that they need when they need them. So our recommendations are meant to be high level. They're meant to be strategic guidance to help ASPR to ensure that the PHEMCE does what it can to fulfill its mission. It's a complex mission, and coordinating is one of those responsibilities you can always get better at. And so we expect that there will be times that there will be room for improvement year to year, but it's an important mission, and they need to be given the tools for which to do that. And I think that's my last slide. Next slide. And now I'm going to turn it over to Tia Powell to give some remarks from her experience on the committee.
Thank you very much, Dr. Grunwald. So I am Tia Powell. My expertise primarily is in ethics and equity, including as these relate to public health disasters. And I'll mention I don't have any slides. I'm just going to talk for a minute or two. I note that a sensitivity to health equity is especially important during public health disasters because they are in part defined by a scarcity of resources relative to need. PHEMCE has a key obligation to ensure that scarce health resources go where most needed based on evidence and keeping in mind past exclusions of specific vulnerable communities. I'm going to quickly walk through some of the ethics principles that we noted in the report that we think can help guide PHEMCE as it revises policies. This does not mean that we think PHEMCE did something unethical before, but rather that all public health enterprises, and particularly related to disasters, must overtly incorporate ethics principles into their policies, or we are at risk of getting some things wrong. Here's what I mean. One of the principles that we think about, and it's not technically a principle, but we hope that PHEMCE will focus on trust building. This is an era, a very low level of trust in government generally. That's been going on for decades as the level of trust has eroded. But it's also true, so that's a general problem for PHEMCE and every other government entity. It's also true that in our public meetings, we heard a good deal from both external and internal partners to the committee of the view that PHEMCE was not optimally reliable, efficient, or flexible, and so they could not put their trust in PHEMCE to get the job done when the hammer really came down and COVID hit us. The other principles we think are intended to help with building greater trust in PHEMCE as an entity, something that people can rely on. Fairness, of course, is the overarching principle in most government public health ethics discussions. It's natural that in a major disaster like COVID, all sorts of government entities, state, local governments, private institutions are and should be concerned about the health of their population. They're eager to secure resources, and they will come to the federal government banging down the door saying, we need this. It's quite imperative that PHEMCE has a way of basing allocation of scarce resources on evidence. Resources need to go to where they are most needed and not to where the voices are loudest. Another principle that we draw your attention to is transparency, and Dr. Granval mentioned this in recommendation 7. Ethics generally is improved by transparency, but of course it has to be balanced against other concerns, including national security. But there are some relatively easy things that PHEMCE can do first to promote transparency. For instance, I work for a New York healthcare institution, and there were many challenges for health institutions in April when the pandemic first peaked. They didn't know what kind of protective equipment, which was scarce globally, was in the strategic national stockpile. They didn't know what sorts of emergency ventilators were there. There's no reason to keep those things secret. Your enemy in the context of COVID is a virus. You're not keeping a secret from it by not telling it what's in your stockpile. What you are keeping a secret from is the people who need to train their staff how to use this unfamiliar ventilator to save lives that are minute by minute on the line. It would have been better if we could have trained people in advance knowing what equipment we'd be getting. That's the kind of thing that's relatively easy to do. Other things are much more difficult. There can be proprietary information, there can be strategic discussions that ought not to be before the public. But there should be a good, solid mechanism for addressing that kind of issue case by case, so you can balance security needs against a helpful flow of information as appropriate to the end users. The other principle I'll mention is accountability. PHEMCE, like most of us, should be conducting regular after-action evaluations, ideally by a neutral third party. And this is addressed in one of the recommendations. That's how all healthcare organizations learn. They constantly are doing a kind of systemic evaluation of what they did and what they could do better, trying to figure out how to do a better job at saving lives and protecting health. The final principle I'll mention is stewardship. Again, because disaster means scarce resources, it's critical to use resources prudently in planning for and responding to disasters. PHEMCE needs to think carefully about how it uses its budget, its human capital, and other resources to provide the greatest degree of safety for the population, given a wide array of threats, including emerging diseases like COVID, but also climate change, extreme weather, bioterrorism. The grandparent of PHEMCE began many years ago as a way of responding to weapons of mass destruction. The lesson of COVID is that mass destruction can come in many forms, including viral. PHEMCE needs its policies to show that it can use our resources wisely for the greatest value to the public. And I'll stop there. And I'll turn it over now to Craig. Thank you very much.
Thank you, Tia. And I love listening to you describe those things, because those are the basic values that I think have to animate any action we take on behalf of our people. Some would say, in looking at this, that we may be adding complexity to the already complex environment by advocating that we need to bring the private sector in, give them an active role and an involvement in the process. But I would argue that the sum of our recommendations really is to simplify this process through clarity of our mission, the return to a clear definition of what that mission looks like, and that's in fact what we're all trying to move towards. And then facilitating that through a clear definition of the roles and the accountability for each party, what they're going to do, and transparency of a systemic approach to operational planning and execution. And as we've mentioned, lastly, evaluating our effort to assure that we understand where we failed and where we did well, whether that's missing the needs of a vulnerable population, whether it's the failure of a distribution system, whether it was the failure of production because of quality assurance issues. We need to know and understand what those are so that we can improve our process. But by bringing these principles into play as put in the recommendation process, we believe that it can be more clear and simple to understand where we're going and how we're going to get there. I think the committee as a group felt like, yes, the initial attempts with PHEMCE going back 15 years ago or so had merit in their principle, that there were periods of success, but that there have been periods of failure as well. But we're optimistic that PHEMCE can and will be improved and can be an effective enterprise. And here, understand that the definition of enterprise is not about a business. It's about accepting a significant challenge where multiple stakeholders have to all contribute to the success of that meeting that challenge. The Apollo mission has been identified as the paradigmatic example of this. So this effective enterprise can be brought to pass if these recommendations are embraced, funded, and acted upon with authority. Because remember, somebody has to hold people accountable for the process. And the end game is to get the right products to the right people at the right time. And again, we're optimistic that PHEMCE can be a tool for making that happen and happen effectively to protect the well-being of our people and to contribute to our national security needs. And with that, I'll turn it back to you, Alan, and thank you very much.
Great, thank you. And I think we can drop the slides. Matt, let me just show you that was the report. It is up on the National Academies website. I looked at it earlier today and it looks great. I recommend it to you. For those of you who have a very short attention span, there's a highlights document that accompanies it that covers many, not all, of the points that you've heard today and the points that are reflected in the report. And so I believe that I turn this back to Stephanie Miceli, who will help coordinate the Q&A session so we can open it to the public.
Yes, indeed. And just a reminder, if you'd like to submit any questions, there is a handy Q&A button at the bottom of your screen. So we'll start with a question from an attendee. Has there been any discussion regarding the inclusion of state, local, tribal, and territorial public health stakeholders or representatives, especially medical countermeasures coordinators in the PHEMCE itself or the proposed advisory board?
Yes, the answer is yes. That is to say that we didn't analyze who is every stakeholder, but in fact, it's vitally important that the PHEMCE coordinating group get input from everybody who's involved in this process, one way or another, either the producers of the various medical countermeasures, the people who have to implement it, so that we can make sure that any decision that's made, this is so obvious once said, but that any decision that's made is as informed as it possibly can be. And so those are vital implementers. They're not just stakeholders, they're implementers as well. And it would be foolish not to get their input as a part of the decision process.
Thank you. This question was directed at Craig, but others can certainly jump in. what does success actually look like for a multi-agency coordinator such as PHEMCE, and how should we grade the ability of the government to coordinate response? What are the best metrics to use?
Well, I think there are a number of important metrics, but one that we have to underscore is the output, the product that they actually deliver. And again, remember, we're talking about right product, right persons, right time. And so ultimately, the success of this organizational effort has to be determined by, did they get that product done? And did they get it out there? And did they get it to the right people at the right time? So it's the overarching expectation. It's less about process and evaluating the process necessarily, how many meetings did people attend, et cetera, et cetera. It's more about, did we meet the needs of the people as demonstrated by the delivery of that product, whether it's shots in arms, whether it's ventilators on the ICU unit, or whatever that particular product need is, that we deliver that in the right time to the right people, and that it's one that they can use. And underscore what Alan said, the end users, I mean, ultimately it's about the patients that we provide care for. It's the communities of concern. But if we don't provide those end users input, how will we know what the most effective tool in dealing with their patients that they deal with on a regular basis, that we're giving them the right tool? So that's, to me, the ultimate measure of success.
I just add that we have described in the report in a number of places that, having exercises, simulations, sprints, all these things can be really helpful in figuring out, how well the system is prepared. And so the advisory board can help with that as well, to see if what lessons need to be learned, what gaps remain. It needs to be an evolving, preparedness, and we need to keep looking at this. We can't let it just be neglected and slide away, because we know that we will have future health security threats.
We have another question for you, Gigi. What is the exact relationship between the PHEMCE and the Strategic National Stockpile SNS? The SNS seemed to have a lot of problems, such as equipment that was outdated. How would your recommendations prevent something like that from happening again?
So the PHEMCE does have have a report every year on the Strategic National Stockpile. And we did hear, and of course, we heard in the press about the SNS and how that was not adequately, stocked for COVID, but we heard other comments, about pre-COVID conditions for the SNS. And that's why in our recommendations, we said that we need to look at not only that there should be a separate investigation of the SNS, but not just, the SNS processes, but how well does this evaluation that PHEMCE does every year, how well does that actually help the SNS to improve? So it's a bigger problem than just, that the cupboard was bare. It's more like, well, what do we do to make sure that the cupboard is not bare in the future? So it's a bigger investigation that that was beyond the scope of our committee, but it's important to do.
Mm-hmm. Yeah, could I add to that, Gigi, that for those of you in the audience, remember that a lot of discussion around PHEMCE focuses on the discovery and advanced development and production of new products, diagnostics, vaccines, whatever. But the end game is about, how do we get that distributed? What's the last mile set of features? And as Gigi said, we were not asked specifically at the SNS as a component of that last mile piece, but we recognize that as a real challenge. And that is an issue that the ASPR and others will have to address very succinctly to assure that we're effective in that last mile distribution process.
Before you continue, Tia, Craig, do you want to mention the other work that's ongoing in this process?
Sure, thanks, Gigi. For the audience, you should note that in the CARES Act, the National Academies were asked to examine and offer recommendations on how to improve the security of the medical supply chain. And that was not a short request, that was a longer request. That committee has been working, we're coming close to finalization of the recommendation process. And we'll tell you without revealing the recommendations because they aren't finalized yet, but we deal very actively and broadly with these issues of last mile and the SNS and its role in the delivery of these products. So that report should be coming out in the next couple of months, probably January, I think, after it's gone through review, et cetera. So look forward to seeing more specifics about how we think the committees think this might be done and done more effectively.
Stay tuned. Okay, sorry to interrupt you, Tia.
No, not at all. I was just going to add, really, and Admiral van der Wagen also referred to this, really, it was not our job to make recommendations about the content, but we were struck that many people who reported to the committee did not find in PHEMCE the kind of best practices today, system review that large health institutions, that industry has, that really looks at quality control, quality improvement, the continual sort of look at what we can do better, how are we managing what we're doing. And that is specifically a recommendation that PHEMCE adopt a systems approach to look at the specific question you're asking about pediatric dosing, but really how do you have in place all of the kind of systems that review and look to quality. We didn't see those, and we hope that they'll be part of the revision going forward.
In the recommendations, is there a provision for reviewing the most current and best practices, for example, pediatric dosing for radiological and nuclear countermeasures?
So there is, of course, as a part of the advisory committee's function, there would be discussions about specific recommendations that are going to go forward. Again, those recommendations go up the chain. They go to the Secretary of HHS and to the Assistant Secretary. We don't get into the detail of, once you make the recommendation, get it reviewed again. But of course, the members of the PHEMCE itself are not all going to have the necessary expertise. So they're going to bring in experts as a part of the process, and hopefully will in fact go through some kind of review process before they go forward.
Thank you. The next question is, the strategic national stockpile was designed for smaller incidents, not a nationwide, worldwide pandemic. How does PHEMCE plan to address pandemic support versus local health jurisdictions or grants that focus on bioterrorism, which perhaps is less likely to occur than pandemics?
Gigi?
Yeah, I would say that the PHEMCE has all of those things in its mission space. So it's not just pandemics are part of our charge, as well as as bioterrorism, dealing with radiological and nuclear threats. So it's really a big job, and that's part of why, or that's a big reason why we have recommended the things that we've recommended. So to be able to prioritize, to coordinate the work of all the different agencies that are focusing on individual threats, and to bring in expertise where it's needed. I think that question at the heart of it, though, is about it's addressed by our recommendations about communication. You need to know what is the PHEMCE is planning, what is prioritizing, what the SNS is planning and prioritizing. Otherwise, these local jurisdictions can't do their own planning. And so that sort of two-way communication is really important to be able to quickly respond to health security threats, regardless of what they are. Tia?
Yes, and I just quickly add to support Dr. Gronvall's point. You can't really build a strategic national stockpile that's on the scale of something like COVID. It is there to be strategic, to get you started, to make sure that if something horrible happens quickly, you've got what you need to get started. And then the systems approach will help you figure out what more do you need, how do you get that, how do you address the ongoing issues as you begin to get better information about what is the scope and the size and the nature of this this thing that you're up against. So I think we talk about revising approaches, systems approaches to look at the strategic national stockpile so that it's got the kind of flexible, items that can be used in lots of different disasters, as well as specific ones for just a few. So that's kind of how I think.
Craig.
Yeah, and this again goes to the supply chain question that I mentioned earlier, because to deal with it comprehensively, you have to have a comprehensive understanding of the supply chain, from raw materials to shots and arms. And heretofore, we've not understood the medical industrial base, if you will, that is the industrial base that produces these kind of products, has not been dealt with in a coherent way. And so as we think forward about this, again, I would say there will be some very interesting recommendations coming forward from the supply chain group that I think will address more comprehensively the question you've raised. Because as Tia has said, the stockpile ain't gonna, you can't stockpile your way out of this. You've got to have a more comprehensive plan to deal with those supply chain questions. And that's, stay tuned, folks. You're going to hear more soon.
Great.
The next question is for both Craig again and Gigi. The roles of PHEMCE partners within medical countermeasures research and development are continuing to merge, whereas NIH and NIAID is supposed to focus on early research, while BARDA is supposed to support advanced development. It seems NIH is moving into more advanced development while BARDA is moving back into basic or early research. Is this an area of concern to the committee?
So I'll say that the committee didn't really take this up. That is, the question, pardon the expression, of turf wars among the various agencies, luckily, is not the domain of the committee like the PHEMCE. Having said that, all good organizations will evolve and look at themselves as they evolve, and hopefully the PHEMCE will continue to do that. Stagnation isn't good for anything. As to the more specifics of the question, perhaps some of the PHEMCE meetings can be used for productive discussion among the various people playing, but it's not really the PHEMCE's domain, who does exactly what. It's bad enough trying to come up with how to control the medical countermeasures, let alone try to control turf.
Craig.
Yeah, as Alan said, it's a shifting reality. And the question the ASPR has to ask is, do we have someone who can do this functionality? I don't care if it's A or it's B or it's C. Let's identify that that's a functional need and we're going to assign it. And if things are evolving, things are evolving, as long as you have clear understanding of that functional expectation and who's accountable to deliver that component of the product that gets us to the right product, the right time, and the right people.
I have nothing to add to that.
It looks like we have one last question. How can PHEMCE balance the demands of transparency and the need to protect information that may compromise national biosecurity or intellectual property?
So I'll make a general statement, then I'm going to turn to my colleagues. There is always a need in anything that has any risk attached to it to balance the need for transparency and security. But as Gigi Grunwald frequently says, You can't operate in a skiff all the time. So the problem we were trying to address is not the problem of balancing them. The problem is overdoing the secrecy. That is, it's very important to be transparent when you can. There will, of course, be exceptions. There will be times when national security is at risk, and therefore you can't reveal everything, but you should reveal as much as you possibly can. Gigi, do you want to add to that?
Yeah, just that you can't prepare for threats you don't know about. You can't coordinate and get people to be working together to address a threat that you don't know about. So you do need to talk about what the threats are, even if you're not talking about specifics and prioritization. You do need to be able to communicate with people who are implementing. And that's something that has been a challenge for PHEMCE in the past. People who are on the ground responding to health security threats need to know what's there for them to respond with. And so there's a point where a lack of information becomes a security concern, and not a benefit to security.
I'll quickly add too, I mean, the ultimate goal is to protect the health of the population. So when secrecy is not doing that, as Gigi says, then that's not helpful. I also think, how you evaluate the need for secrecy kind of depends on who or what you're up against. If you are up against a human entity that might look at what you're doing and then change what they're doing, a bioterrorist or something like that, that's one thing. When you're up against a virus, it doesn't care what you say out loud. That's not really how it's, operating. So keeping secret what kind of protective equipment you have, really, it's hard to find a case in which that would be extremely important. But certainly when you're talking about general disaster relief against extreme weather conditions, if you need to, or evolving infectious diseases, all of that kind of stuff, probably, unless there's some specific example, probably best to just really get that information out there and let people plan, let them think about, okay, they're doing that, but we have a particular concern here in our geographic area. We'll add this because we don't think that's covered there. That kind of thing, I think, will help us think about secrecy when we need to, but keep our eyes on the ultimate prize, which is saving lives.
Craig, you have your hand up.
Did the committee make any, I'm sorry if I cut you off there, Craig.
No.
Did the committee make any recommendations on the best system to have the recommendations accessible to those who need it? These evolve over time and books take a long time to be updated. Potential information distribution could be a countermeasures wiki, for example.
I not to sound like a government bureaucrat, which I was for many years, but if the PHEMCE is operating in the kind of open environment that it needs to, then most of the recommendations will be known or they will become apparent. However, within the government, the PHEMCE reports to their higher-ups. And at some point, it becomes a decision not of the PHEMCE. The PHEMCE is not the implementer, it's the coordinator. And therefore, some of those recommendations may not become as widely known as some people might like. That's just sort of reality. Having said that, as recommendations change over time, hopefully the PHEMCE, if it's operating properly, will revisit them and will say, whoops, that one was really good 4 years ago. It's not so good now. Or we need X now instead of Y that we needed before.
I would only add that a countermeasures wiki sounds like a great idea to have as a supplement to what is going on in an advisory committee. I'd love to see the PHEMCE and the work of health security preparedness raised to the level where people are creating activities around it to call attention to the work that's being done to prepare for all threats, not just the ones we're living through right now.
Thank you all. It looks like those are all the questions that were submitted, and I know we're a little past the 2 p.m. mark. So again, thank you all for joining us this afternoon. And once you exit this webinar, you'll actually be redirected to our report page where you could download the report, those nifty highlight summaries, and the press release. So thank you all again, and especially thank you to our speakers. Have a great rest of your afternoon.
Thank you all.
Thank you.